Bismillahirrahmanirrahim. Today we are going to start with the internal iliac artery. Internal iliac artery is the branch of common iliac artery, which is a branch of abdominal aorta. Internal iliac artery moves into the pelvis and at the upper border of greater sciatic notch divides into the anterior and posterior branches. The anterior division gave the parietal and visceral division. The parietal one supplies the wall, which further gives inferior gluteal vessel and obturator artery. Inferior gluteal supply the gluteal region and obturator artery supplies the obturator branches and iliacus muscle. The visceral branches are 6 in number and 4 in number in males. Superior vesicle, which supplies the superior surface of bladder. Middle rectal, which supplies rectum, prostate, seminal vesicle. Inferior vesicle, which supplies bladder. Vesicle mean bladder. So inferior vesicle supplies bladder and prostate and seminal vesicle. Internal pudendal supplies anal canal, penis and clitoris. Vaginal and uterine, these both are present in females. Vaginal supply vagina, bladder, and uterine artery supply vagina, uterus and oviduct or fallopian tube. The posterior division gives parietal and visceral branches. Visceral branches are not present. Parietal branches are iliolumbar, that supply iliacus and lumbar back muscle, muscles of back of lumbar region, and lateral sacral, which supplies chorda equina. Chorda equina is the tapering end of the spinal cord, and back of sacrum. Superior gluteal, which supplies gluteus medius and minimus. To revise the whole story of it, internal iliac is the branch of common iliac that arises from the abdominal aorta. Internal iliac gives anterior and posterior division. The anterior division has parietal and visceral branches. Parietal branches are inferior gluteal and obturator. Visceral branches are inferior vesicle, superior vesicle, middle rectal, internal pudendal, vaginal and uterine. In superior inferior vesicle, middle rectal, internal pudendal, vaginal or uterine. And the posterior division gives parietal branches. These are iliolumbar, lateral sacral and superior gluteal. This is the abdominal aorta. These are the two terminal branches of abdominal aorta that are common iliac branches. Common iliac divides into the internal and external iliac. Internal iliac at the upper margin of greater sciatic notch divide into posterior and anterior branches. Posterior branches give superior gluteal artery and iliolumbar and lateral sacral that are not seen in the diagram. The other branches are anterior branches. Anterior branches give obturator artery, internal pudendal artery, inferior vesical artery, superior vesical artery, middle rectal artery, vaginal and uterine artery in females. The vein are as such opposite of the arteries.